when you grow up, there's a lot of stereotyping.
Mm-hmm.
And the controversy comes in because of the type of painkillers we receive. We go through so much pain. So we need opioids sometimes for these pains. And sometimes doctors and nurses will go like, you're just addicted to it. You just want this drug and everything. So it's stressful. Those are some of the challenges I would say, especially as an adult sickle cell patient. Because it's a lot of, why should I start convincing you to say, I'm in pain? For me to leave my home, my bed, nobody wants to leave their home at 01 to come and receive pethidine in the middle or morphine at 01, even if you're addicted to it. And then who's an addict? Really? So some of those words are really offensive. So those are some of the challenges. And then just people generally think sickle cell is painkiller, water, IV fluids, then it's done. It's bigger than that. Sickle cell is deeper than that. And sometimes I just feel like the health profession, the people just don't want to read about it. They assume they know it, and yet they don't know it and how deep it is. I how wish we had, though we have a course, like a master's in HIV AIDS, how wish you could have a master's in just sickle cell, because sickle cell affects every part of your body from head to toe. So people don't know sickle cell. People don't know basics. Sometimes I have people even just like call me and they're from the village or, like far away, Mongo and whatever. They don't even know the use of folic acid. Like the point of contact, the health point of contact, that doctor doesn't even know that the person needs folic acid. I've had moments where my HB is low and the clinician suggests to say, let's give you iron sucrose. I'm like, but we can't give iron in sickle cell. Exactly. The times when I've gone for a scan, I'm doing an abdominal scan, and this radiographer starts panicking and saying, I can't see your spleen. I'm like, if you know that at this age, I've undergone autosplenectomy.
Yeah.
So what scares me is from those basics. People don't even know the basics, So that's where the challenge is. I think we need to train more people. Yeah. But they're actually also good doctors, who know what they're doing. For example, Dr. Sambo, Dr. Mwandama, Dr. Dr. Chunda, those are people who know what sickle cell is, and if you're seen by them, you're in safe hands. So they're actually also good doctors, but there are a few. So I wish it can be leveled up, Yeah.
Okay. So I really got interested in that, the opioids. You said there's this conception that some of the sickle cell patients are addicted. But opioids are addictive.
Yes.
So do we actually have sickle cell patients who are addicted?
Yes, they are. So research shows about 10% of sickle cell patients.
Only 10%.
Yes, can actually now the number has gone up. Then it was about like 2%. So, but now the number is at 10%. So what we also as a physicians are the reason why we have sent these people into addiction, because I've noticed.
But if we don't give you, you're going to say that.
So there's a way
of stereotyping.
This is what happens. We withdraw opioids the wrong way. You don't drastically just stop opioids. You're supposed to taper. Okay, it's also our environment. Maybe we don't have enough. So what you're supposed to do is supposed to taper down. So if you start morphine, right, you control the pain. You just don't go to zero. Okay, so what happens, because if you just stop, the body goes into what we call withdrawal. And then with withdrawal, with the sickle cell, withdrawal comes with pain. And then the process of going through a withdrawal will take that sickle cell patient into a crisis. So now they have this cascading cycle going on and going on. And then also remember that before someone reaches addiction, there's tolerance, then dependency, then addiction. So sometimes doctors will see their patients become dependent and not consult the psychologist,
But how are we going to know that?
So dependency comes in, like, for example, where your patient now is dependent, like if they don't give them the opioids, they cannot function.
But then you're going to tell us that you are in pain. And it's very hard to argue with someone in pain, because they say each kalipa chumfomwine. So it's very hard for you to know that, okay, now this person is just being dependent. So what advice would you give us, the
And
healthcare
then
workers?
there's no enough information also. Because, you know, I only learned about opioids and their side effects because I'm in the medical field, but I don't remember that conversation ever being had with my mom. You understand? So those are some of the things you, even as a doctor, you need to sit down and say, okay, we're giving your child this, but you need to look out for this. So that when you see this tendency coming, you alert us.